All right, we're back again. Let's talk about hay fever. Hay fever is a generic, non-specific term for what is referred to as allergic rhinitis. Uh, the prefix rhine and rhino refers to nose, so this is the stuff that causes your nose to run. Uh, it is primarily a seasonal reaction to inhaled plant pollens or mold. Can be a chronic year-round reaction to airborne allergens or inhalants. Uh, my wife, for instance, suffers from both seasonal and year-round reactions. In the springtime, she is highly sensitive to plant pollens. Year-round, she is allergic to dust in our home. So we are, or I am constantly dusting our home. Most folks, I don't know how often most folks dust. I dust almost daily to keep the dust levels down. So my wife can actually function because her dust allergies are so bad that she will develop migraine headaches, and at that point, she's useless to me. So I try to do everything I can to keep her from having those really, really bad headaches. The targets of hay fever are the respiratory membranes. The symptoms of hay fever are nasal congestion, sneezing, coughing, profuse mucus secretions, uh, itchy red and teary eyes, and some people have mild bronchoconstriction. Again, that's that sort of tightness in your chest where it just feels like it's almost laboring to breathe. Asthma is a respiratory disease that is demonstrated through episodes of impaired breathing due to severe bronchoconstriction. Airways of asthmatics are extremely sensitive to minute amounts of inhalants, ingestants, and other stimuli, such as certain infectious agents. Symptoms can range from bouts of difficult breathing to fatal suffocations. Rales is the term used for the clicking, bubbling, or rattling sounds that can be heard in the lungs using a stethoscope. Uh, in this case, or in this conditions, the respiratory tract overreacts to leukotrienes and serotonins. The leukotrienes and serotonins that are placed there, secreted by the respiratory tract to eliminate pathogens. Folks with asthma will overreact to these, whereas folks without asthma just take these things in their stride and they don't bother them. In these cases, natural killer cells are sometimes also recruited and activated. In the worst case scenarios of asthma, it's these and these that are causing the problems. All of those things causing issues. Atopic dermatitis or eczema is intensely itching, inflammatory condition of the skin. Here you see a little baby child with what is referred to as neonatal eczema. Most children, a high percentage that have this, will grow out of it. This is a more systemic, that looks like somebody's arm probably. This type of eczema is much longer lasting in most cases than this type of eczema. The sensitization occurs through either ingestion, inhalation, or skin contact with allergens. Usually begins in infancy and is characterized by red and encrusted lesions on the face, skin, neck, and inner surfaces of the limbs and trunk. Progresses to a dry, scaly, thickened skin condition in adults. The lesions can be itchy, they can be painful, and thus they are predisposed to secondary bacterial infections because these things will often crack and expose the inner parts of the skin to these bacteria. Food allergies. Everybody pretty much knows somebody with a food allergy. Most common food allergies come from peanuts, fish, cow's milk, eggs, shellfish, and soybeans. The mode of entry for all food allergies that I know of is intestinal. The symptoms will include vomiting, diarrhea, and abdominal pain. You can also, these diseases or these allergies can also manifest themselves in hives, which is sort of a scaly rash that's very itchy on the surface of the skin. rhinitis, again, a runny nose, asthma, trouble breathing, and occasionally anaphylaxis. Folks with peanut allergies especially can suffer this one. The hypersensitivity that occurs here involves the IgE form of gamma globulin and degranulation of mast cells, but not all reactions will involve this. Care should be taken with vaccinating individuals with egg allergies. As I have said multiple times throughout the semester, if you tell me the reason you don't take the flu shot each year is because you have an egg allergy, I can respect that. Drugs are foreign compounds capable of stimulating allergic reactions. Lots of people have drug allergies. Drug allergies are one of the most common side effects of drug treatment, affecting 5 to 10% of hospitalized patients. The reactions of drug allergies can be anything from as mild as a rash to a fatal anaphylactic reaction. Some common drugs that people are allergic to, certain antibiotics, especially penicillin, synthetic antimicrobials such as the sulfa drugs, aspirin. Believe it or not, people are allergic to aspirin. The opiates, you wouldn't think about opiates being allergic, or people being allergic to opiates, especially with the opioid opioid epidemic we've got going on in this country at this time. But there are people out there who are allergic to opiates. And the contrast dye used in x-rays. Again, the allergen is not the intact drug itself, but a hapten given off when the liver processes the drug. So as the liver and the body's processes start to break down the drug, some of those smaller molecules can then bind with other things, and that's when they become allergens. Anaphylaxis, also known as anaphylactic shock, is a swift reaction to allergens. You can have a couple of different forms. You can have what is referred to as the cutaneous anaphylaxis, and that again is referred to as wheal and flare. It is an inflammatory reaction at the local or at the site where the allergen is injected. So those of you who have, for instance, had a flu shot and then had that the area right around the flu shot maybe swell a little bit, get hot, painful to the touch, burn, that is an example of cutaneous anaphylaxis. That is the flare reaction. Systemic anaphylaxis is characterized by sudden respiratory and circulatory disruption. It can be fatal within just a few minutes due to the constriction of the respiratory system and the airway literally being blocked. Bee stings are the primary cause of anaphylaxis in the United States. Injections of certain antibiotics or serums can also be implicated. What happens here is there is a sudden and massive release of chemicals into the tissues and blood. These tissues act rapidly on their target organs, causing, again, vasoconstriction, bronchioconstriction, vasodilation, I apologize, and bronchiorestriction. Vasodilation shunts a lot of blood into the skin, so there's not a lot of blood left in the system for the heart to be pumping around. Constriction of the respiratory tract, bronchioconstriction, squeezes everything down, and that's where you feel like you're fighting for your next breath. Diagnosing an allergy, blood testing. Radioallergosorbent or RAS testing measures your level of IgE to specific antigens. There's something called a tryptase test, which measures your level of tryptase, which is an enzyme released by mast cells that increases during an allergic response. A differential blood cell count can reveal high levels of basophils and eosinophils, and leukocyte histamine release tests measures the amount of histamine released from a patient's basophils when exposed to a specific allergen. You've ever had uh, a allergy test? This is the one that they most commonly use, whereas they inject small bits of an allergen into your skin. The skin is injected, scratched, or pricked with a small amount of a pure allergen extract. A wheal and flare result is taken in 20 minutes after the antigenic challenge is indicative of histamine release. So these would all be examples of the wheal and flare result. These up here, you don't see any reaction. The diameter of the wheal is measured and rated on a scale of 0 for no reaction to 4 with the greatest reaction. And then you have a chart here that you keep account of, and you'll notice if you can look at this on your computer and not try to depend on what you're seeing on this screen, you see a number of plus signs. The more plus signs you see, the stronger the reaction. If there's an X, that's a not the test wasn't done for some reason. If there's a 0, that's no reaction. You can see whoever this person was, they didn't do the horse serum test, but they did do horse dander, and you'll notice this person reacted to everything. Then you had, these are environmental standards. Then you have airborne standards like like ant particles, aphids, bees, houseflies, house mites, mosquitoes, moths, roaches, wasps, and yellow jackets. These are all things that parts of these animals can be found in the dust in your home. These are airborne mold spores, again, that are tested for, and you'll see that this person, the house mite, they didn't test the house mite, had a 0 reaction to penicillin, a 0 reaction to yellow jackets, but you see they were highly reactive to aphids, bees, houseflies, and moths. So again, very large wheels formed on these structures. You take drugs to block the action of lymphocytes, mast cells, and chemical mediators. That's one way to prevent allergy. Another way is to simply avoid the allergen. In lots of cases, this is it's not only difficult, but it's not feasible. Desensitization, if you know someone who's gone through and had a series of allergy shots, that is a desensitization process. We're taking the patient, exposing them to the antigen through either digestion, sublingual absorption, or injection through an attempt to reset the allergic reaction. Again, my wife went through this several years ago, the desensitization process, and it was a complete and utter failure. It did not offer her any respite at all from her allergies. If anything, I think it made her allergies earlier onsetting in the spring and lasting longer into the fall. Type 2 hypersensitivities. You have a complex group of syndromes that involve complement-assisted destruction of cells by particular antibodies, here the IgG and IgM. This is an example, again, transfusion reactions. Somebody is type A blood and they are given type B blood. Some types of autoimmunities, and we'll talk about several different autoimmune conditions here in a moment. Alloantigens are molecules that differ within the same species. These molecules are recognized by lymphocytes of the recipient. It is not technically an immune dysfunction. In this case, the immune system is functioning normally by reacting to foreign cells in an organ or tissue transplant. The Rh factor, this is the part of your blood that gives you the plus or minus, and its importance. Was first discovered in experiments exploring genetic relationships among animals. Rabbits injected with red blood cells of the rhesus monkey produced an antibody that also reacted with human red blood cells. This monkey antigen, we call it the Rh because it was the rhesus monkey, was present in about 85% of humans and absent in about 15% of humans. So 85% of humans are A positive, B positive, AB positive, or O positive. About 15% of humans are A negative, B negative, AB negative, and O negative. The Rh positive is the dominant gene. The Rh negative is the recessive gene. If your mother is negative and your father is negative, you will be negative. If your mother is positive and your father is positive, there is a probability you will be positive or you could be negative, depending on the specific genes that your parents have. We're not going to talk about basic genetics here to determine which one those is. You'll get that in your A and B class. You actually should have gotten it in your biology class. But I do want you to realize if both of your parents are negative, you are negative as well. Because there's no way mom can give you a positive if she doesn't have one to give, and there's no way dad can do the same. The only way to develop antibodies against this factor is through exposure to a fetus's antigen, while pregnant or during a transfusion. The hemolytic disease of the newborn. Placental sensitization occurs when the mother is Rh negative and the unborn child is Rh positive. Historically, what had to happen in these type of situations, when the baby was born, the baby had to instantly be given a blood transfusion, a full body transfusion. Now there are drugs that we can give the mother to prevent hemolytic disease. But fetal red blood cells may leak into the mother's circulation during childbirth when the placenta detaches. The mother's immune system detects the foreign Rh factors on the fetal red blood cells and sensitizes to them by producing antibodies. And it does not usually affect the first child because the process occurs so late in pregnancy. Normally, the issue is with all subsequent children. In the next pregnancy, mom is Rh negative, baby is Rh positive. The fetal blood cells escape into the maternal circulation late in pregnancy, which will elicit a memory response. The maternal anti-Rh antibodies will cross the placenta, affix to the fetal red blood cells, and cause complement-mediated lysis. This outcome is potentially fatal. It's called hemolytic disease of the newborn. It's also called erythroblastosis fetalis, and is characterized by severe anemia and jaundice. This is another case where when these babies are born, they have to undergo very extensive treatment immediately. And this shows, here's mom, Rh negative, baby Rh positive, good little baby be born. Then second pregnancy could go this way, and nice little healthy baby, but here we could have a hemolytic newborn, depending on how late in pregnancy this crossover actually occurs. How do we prevent this disease of the newborn? Once sensitization has occurred, all other Rh fetuses will be at risk. First of all, we have to have a careful history of the Rh pregnant woman is needed. Rh types of children and Rh status of the father are needed to be known. If the mother is negative and the father is negative, there's no risk to babies. If the father is Rh positive, then the fetus may very well be Rh positive. The antiserum that is given to Rh mothers with Rh negative mothers who have Rh positive partners is called RhoGAM. This elicits passive immunization for the Rh negative mother with an Rh positive fetus. The immunoglobulin fraction of human anti-Rh serum is prepared from a pool of human sera. In other words, that's sera from a bunch of different people. It is injected at 28 to 32 weeks, and again, immediately after. This immunoglobulin will sequester fetal red blood cells that have escaped into the maternal circulation and prevents sensitization. It must be given with each pregnancy with an Rh positive fetus. So every time mom gets pregnant and dad is Rh positive, baby will be tested. If baby is Rh positive, and I don't quote me on this, I'm not a doctor, I don't play one on television, but I think as simply a precaution, RhoGAM is given to pretty much all Rh mothers who have Rh positive spouses or partners, and it is given simply as a precaution. All right, I'm going to stop there for a few minutes, pick back up with type 3 hypersensitivities after what?